A 52-year-old man arrived at the emergency room with severe chest pain, dangerously low blood pressure, and struggling to breathe. Within minutes, doctors discovered he had taken Tadalafil just hours before using nitroglycerin for his heart condition. That combination nearly cost him his life. This isn't an isolated case. Every year, thousands of men end up in emergency rooms because of preventable mistakes when taking Tadalafil. Some of these errors seem harmless, others are driven by desperation for better results, but all of them can have serious, even fatal consequences. Today I'm going to reveal the 5 most dangerous mistakes men make with Tadalafil. And I'm warning you right now, mistake number 3 is so common that you might be doing it without even realizing the hidden danger lurking behind it. Whether you're already taking Tadalafil or considering it, this information could literally save your life. So before we dive in, hit that like button if you value your health, subscribe to the channel, and turn on notifications because this is critical information every man needs to know. Let's get started with the deadliest mistake of all. This is the #1 rule that can make the difference between life and death. Mixing Tadalafil with nitrates is not just dangerous, it's potentially fatal, and here's exactly why. Nitrates are medications commonly prescribed for chest pain, also known as angina. They come in various forms: nitroglycerin tablets, patches, sprays, or long-acting medications like isosorbide mononitrate and isosorbide dinitrate. These drugs work by relaxing and widening blood vessels to improve blood flow to the heart. Now here's where the danger comes in. Tadalafil also relaxes blood vessels to improve blood flow. When you combine these two mechanisms, you create a catastrophic drop in blood pressure that can be life-threatening. How severe can this drop be? We're talking about blood pressure plummeting to levels so low that your vital organs, especially your brain and heart, don't receive enough oxygen. This can lead to fainting, stroke, heart attack, or even death. The effects can happen rapidly, within minutes to hours, and the dangerous interaction can last up to 48 hours after taking Tadalafil because of its long half-life. This means even if you take nitrates 2 days after Tadalafil, you're still at risk. What medications fall into this category? Any form of nitroglycerin, isosorbide mononitrate, isosorbide dinitrate, and even recreational drugs called poppers, which contain nitrites. If you're taking any heart medication, you must tell your doctor before starting Tadalafil. Here's a critical point many men don't realize. If you're on Tadalafil and experience chest pain, you cannot use nitroglycerin for emergency relief. You need to inform emergency medical personnel immediately that you've taken Tadalafil. This is information that could save your life in a cardiac emergency. If you're prescribed both types of medication, your doctor needs to find alternative treatments for your angina. There is absolutely no safe way to combine these medications. None. This is non-negotiable. Here's a mistake driven by frustration and false logic. If one pill works reasonably well, 2 pills must work even better, right? Wrong. Dangerously wrong. The maximum recommended dose of Tadalafil is 20 milligrams per day, and there's a very important reason for this limit. Taking more doesn't give you better results. It exponentially increases your risk of severe side effects while providing minimal, if any, additional benefit. Let me explain the science behind this. Tadalafil works by inhibiting an enzyme called PDE5. Once you've inhibited enough of this enzyme to get an effect, taking more medication doesn't inhibit it further in any meaningful way. You've essentially maxed out the benefit, but you haven't maxed out the side effects. What happens when you overdose on Tadalafil? The side effects become dramatically worse and potentially dangerous. We're talking about severe headaches that won't respond to normal pain medication, prolonged dangerous drops in blood pressure causing fainting and falls, vision problems that could become permanent, and the risk of priapism, an erection lasting more than 4 hours that can permanently damage your penis. Priapism is a medical emergency. If not treated within a few hours, it causes permanent damage to the erectile tissue, potentially leaving you with permanent erectile dysfunction worse than what you started with. The irony is cruel. Trying to improve your erection by taking extra medication can destroy your natural ability to have erections at all. I've seen men double or even triple their dose out of desperation, thinking the medication isn't working. But here's what they don't understand. If the prescribed dose isn't working, the problem isn't the dose, it's something else. Maybe the underlying cause needs different treatment, maybe there are psychological factors, or maybe the timing of taking the medication isn't right. Taking more than prescribed is also particularly dangerous if you have underlying health conditions like kidney disease or liver problems, because these organs are responsible for eliminating the drug from your body. If they're not functioning optimally, the medication builds up to toxic levels even faster. The correct approach if your current dose isn't working, talk to your doctor. They can adjust your treatment plan, investigate underlying causes, or try different medications. Never ever adjust your dose on your own. Your health and potentially your life depends on following prescribed dosages exactly. This is the mistake I mentioned at the beginning, the one that's shockingly common and incredibly dangerous. Combining Tadalafil with recreational drugs, particularly cocaine, methamphetamine, MDMA, or poppers, creates a perfect storm of cardiovascular catastrophe. Let's start with poppers, also known as alkyl nitrites. These are often used in party settings and are chemically similar to the medical nitrates we discussed earlier. The combination with Tadalafil causes the same catastrophic blood pressure drop, potentially leading to stroke, heart attack, or death. There is no safe amount, zero tolerance. Now let's talk about stimulants like cocaine and methamphetamine. These drugs dramatically increase your heart rate and blood pressure while simultaneously constricting blood vessels. Tadalafil, on the other hand, is trying to dilate blood vessels and manage blood flow. You're essentially creating a cardiovascular war inside your body. This combination puts extreme stress on your heart, dramatically increasing the risk of heart attack, stroke, irregular heart rhythms, and sudden cardiac death. The risk is even higher if you already have underlying heart disease, which many men don't even know they have. MDMA, commonly known as ecstasy or Molly, presents similar dangers. It increases heart rate and blood pressure while also affecting serotonin levels, and when combined with Tadalafil, the cardiovascular risks multiply exponentially. Here's what makes this particularly insidious. Many men use Tadalafil specifically to counteract the erectile difficulties that cocaine and other stimulants cause. They think they're solving a problem, but they're actually creating a far more dangerous one. The temporary fix for performance isn't worth the risk of permanent damage or death. Marijuana deserves mention too. While generally less dangerous than the drugs mentioned above, combining cannabis with Tadalafil can cause significant drops in blood pressure, leading to dizziness, fainting, and falls that can result in serious injuries, especially in older men. Even alcohol, while not technically a recreational drug, can be problematic. Moderate to heavy alcohol consumption with Tadalafil significantly increases the risk of low blood pressure, dizziness, and impaired judgment. The recommendation is to limit alcohol to no more than 1 or 2 drinks when using Tadalafil. If you're using any recreational substances, you need to be honest with your doctor. I know it's uncomfortable, but your doctor isn't there to judge you, they're there to keep you alive. The information you provide could be the difference between safe treatment and a medical emergency. This mistake isn't about what you do with Tadalafil, it's about what you ignore while taking it. Tadalafil can be a powerful diagnostic tool because cardiovascular problems often show up first as erectile dysfunction. Ignoring warning signs while on Tadalafil could mean missing critical, life-threatening conditions. Let me be crystal clear. Erectile dysfunction is often the canary in the coal mine for heart disease. Studies show that men with ED are significantly more likely to have or develop cardiovascular disease, and ED symptoms often appear 3 to 5 years before a heart attack. So what symptoms should never be ignored? Chest pain or pressure, especially during or after sexual activity, is an absolute red flag. If you experience this, stop sexual activity immediately and seek medical attention. Don't brush it off as heartburn or stress. Severe shortness of breath during minimal exertion or during sexual activity is another critical warning sign. If you couldn't climb a flight of stairs without getting winded before taking Tadalafil, and now you're attempting sexual activity, you could be putting dangerous strain on your heart. Irregular heartbeat or palpitations are warning signs that your heart's electrical system may be compromised. Tadalafil doesn't typically cause these directly, but if you notice them while taking the medication, it could indicate underlying heart disease that needs immediate evaluation. Persistent dizziness or fainting, especially when standing up, could indicate dangerous blood pressure problems. While Tadalafil can cause mild temporary drops in blood pressure, persistent or severe symptoms require immediate medical evaluation. Here's what many men don't realize. Sexual activity itself is physical exercise, roughly equivalent to climbing 2 flights of stairs or walking briskly for 20 minutes. If your heart can't handle that level of exertion safely, sexual activity could trigger a cardiac event. Before starting Tadalafil, you should have a cardiovascular risk assessment, especially if you're over 50, have high blood pressure, diabetes, high cholesterol, are overweight, smoke, or have a family history of heart disease. These risk factors don't necessarily mean you can't take Tadalafil, but they do mean you need closer monitoring. Don't use Tadalafil to push through concerning symptoms. If sexual activity causes chest pain, severe breathlessness, or extreme fatigue, these are your body's warning signals that something is wrong. Listen to them. Your life may depend on it. The final deadly mistake is one of the most common: buying Tadalafil from unverified online pharmacies, gas stations, convenience stores, or other questionable sources. This isn't just about legality, it's about your safety and potentially your life. The counterfeit medication market is enormous and terrifying. Studies have found that up to 77% of ED medications purchased from non-verified online sources are counterfeit. These fake pills may contain incorrect doses, dangerous contaminants, or completely different drugs altogether. What's actually in counterfeit Tadalafil? Sometimes nothing active at all, just chalk and fillers, meaning you get zero therapeutic benefit. But more dangerously, counterfeits have been found to contain incorrect doses, sometimes 10 times the safe amount, leading to severe side effects and overdose. Even more horrifying, some counterfeits contain completely different medications, including antibiotics, commercial paint, printer ink, and even rat poison. Yes, you read that correctly. People have been hospitalized and some have died from taking what they thought was Tadalafil, but was actually a toxic cocktail of dangerous substances. Why do men take this risk? Usually it's about 3 things: cost, embarrassment, and convenience. Generic Tadalafil is expensive. Talking to a doctor about ED is uncomfortable, and legitimate processes take time. But no amount of money saved or embarrassment avoided is worth poisoning yourself or dying. Here's how to identify dangerous sources. Be immediately suspicious of websites that don't require a prescription. Legitimate online pharmacies, even those offering telemedicine consultations, will require a medical evaluation and valid prescription. If they don't, they're operating illegally and dangerously. Watch out for prices that seem too good to be true. If a website is offering Tadalafil at a fraction of the legitimate pharmacy price, it's almost certainly counterfeit. Also, be wary of sites that claim to sell herbal or natural alternatives that work just like Tadalafil. These unregulated supplements often contain hidden pharmaceutical ingredients at dangerous, uncontrolled doses. Never buy Tadalafil from gas stations, convenience stores, or truck stops. Pills sold in these locations are universally unregulated, often illegal, and potentially lethal. The same goes for products ordered from international websites without proper pharmaceutical credentials. How do you safely obtain Tadalafil? Start with a consultation with your doctor or a legitimate telemedicine service. Yes, it requires discussing personal issues, but healthcare providers have seen it all and are there to help, not judge. Get a legitimate prescription and fill it at a verified pharmacy. If cost is a barrier, ask about generic versions, which are significantly cheaper than brand names but are FDA approved and safe. Many pharmaceutical companies also offer patient assistance programs for those who qualify. There are legitimate, safe, affordable options available. Your health, your safety, and your life are worth the extra effort to do this right. There are no shortcuts when it comes to prescription medications. Let's recap the 5 potentially life-threatening mistakes you must never make with Tadalafil. First, Never mix Tadalafil with nitrates or nitrites. This combination can cause fatal drops in blood pressure. If you're taking heart medications, discuss alternatives with your doctor before starting Tadalafil. Second, never exceed your prescribed dose. More is not better. It's dangerous. If your current dose isn't working, talk to your doctor about proper adjustments or alternative treatments. Third, never combine Tadalafil with recreational drugs, especially cocaine, methamphetamine, MDMA, or poppers. This combination creates extreme cardiovascular stress and can be deadly. Fourth, never ignore cardiovascular warning signs. Chest pain, severe shortness of breath, irregular heartbeat, or persistent dizziness require immediate medical attention. ED itself can be an early warning of heart disease. Fifth, never buy from unverified sources. Counterfeit medications are dangerous, potentially deadly, and far more common than most people realize. Always use legitimate pharmacies with valid prescriptions. Here's your safety protocol. Before starting Tadalafil, get a complete cardiovascular evaluation. Be completely honest with your doctor about all medications, supplements, and recreational substances you use. Follow the prescribed dosage exactly. Pay attention to your body's warning signs, and only obtain your medication from legitimate, verified sources. Remember, Tadalafil is generally very safe when used correctly under medical supervision. The vast majority of men use it successfully without problems. But these 5 mistakes turn a safe, effective medication into a potential danger. Your sexual health is important, but it's not worth risking your life. Smart, informed use of Tadalafil means better results and staying safe. If this video potentially saved your life or someone you know, hit that like button and share it. You could literally save someone's life by sharing this information. Subscribe to the channel and click the notification bell for more evidence-based health content that could make a real difference in your life. And if you want to learn more about using Tadalafil safely and effectively, watch this recommended video about how to maximize Tadalafil results while minimizing side effects. Take care of your health, make smart decisions, and I'll see you in the next video. Stay safe out there.